As we move ahead, let's begin plenary session 10, for which I warmly welcome our chairperson for this session, Ms. Cecilia Fernandez, ma'am. I request ma'am to kindly come on the stage and take her respective seat. Now I invite our distinguished speaker, Dr. M. Radhika ma'am, to kindly join us on the stage. And to honor their presence, I request Dr. Deepti Shukla ma'am to kindly welcome them with a live plant. Now I request Ms. Priscilla ma'am to kindly come forward and introduce our esteemed speaker, Dr. M. Radhika ma'am.
So good afternoon all. Good afternoon. So it's my privilege to welcome Dr. Radhika ma'am for this conference. Ma'am is PhD in nursing and from National Consortium of PhD in Nursing in Indian Nursing Council, collaboration with the Rajiv Gandhi University Health Sciences 2011 to 2016. Following an MSc in Pediatric Nursing from KGME College of Nursing 2004 and a BSc Nursing from Sri Ramakrishna College of Nursing 1998. Ma'am has the vast experience of 24 years in professional experience. Ma'am has significantly contributed to nursing education and research. Also, she has provided extensive research guidance, mentoring over 1,600 undergraduate projects and 50 postgraduate projects. Ma'am has membership of further enriched in field with active participation in national and international conferences, workshops, and editorial roles. Ma'am also has membership and esteemed organizations such as Critical Care Nurses Society, Nursing Research Society of India, and Sigma Nursing International. Also, she is enriched with a lot of publications and awards. Also, she has presented 30 papers, national and international conferences and publications, research articles in reputed journals. She has been several patent publications, including innovation in glycemic variability analysis using machines, learning and blockchain-based medical data system. She's contributed a lot of academic lectures, literatures, also having numerous awards and been received People Transforming National Award in 2023. Congratulations to you, ma'am. Asian Best Teacher Award in 2023. Best Research Award in 2023. Along with the global recognition like International Teacher Award.
Honor.
Let's give a big round of applause to Madam for all the recognitions she has achieved. Additionally, editorial board of positions for multidisciplinary journal has been held by Ma'am since March 2022. I welcome you, Ma'am, for your guidance further. Thank you.
Thank you, ma'am, Priscilla ma'am, for your introduction. At the outset, a warm good afternoon to everyone. Good afternoon, all of you. I don't hear it from. I don't hear from this side. This side. Good afternoon. A warm good afternoon to everyone. Okay. At the outset, I take this opportunity for congratulating Principal Ma'am, Dr. D.P. Shukla Ma'am, for organizing such a wonderful conference on global summit and such an important aspects in nursing, like vast areas like research, innovation, and digital health. So this is trending topic in the current scenario of digital era and revolution. So it is the right time, it is a high time we talk about these things. And since 2 days we are hearing a lot, and I think you people got oversaturated yesterday with continuous sessions on research and AI, so many things we have discussed. So you have learned a lot of things, right? Yes or no? And I thank Dr. D.P. Shukla ma'am for giving me an opportunity in this conference as a resource person and having given me a session on a topic. Hope you all know my topic. What do you understand? Yes, my session is on mobile health, transforming healthcare through digital. Okay, is the next year. Okay. So let's move on to the topic. Okay. So I have some questions to the audience. When after a few minutes I will ask you, you will have to work on. So be attentive to my session. Okay. So smartphone revolution is underhyped. More people have access to phones than access to running water. We have never had anything like this before since the beginning of the planet. Do you agree? There might be a time even we do not have access to the water, and everyone, almost 90% of the population have access to the smartphone. Even the newborn baby wants to see the mobile even if the mother wants to feed. Okay, so all children are glued to Android device today. Do you agree with me? Okay, so this statement better gives the revolution of digital era. So let's see what is mobile health. It's a use of mobile-based solutions to deliver healthcare and improve medical outcome. And it empowers healthcare sector, and mHealth in India optimizes how information is stored and shared access to improve the public healthcare. And already ma'am has given an insight about patient records, electronic health records, how it is digitalized throughout the hospitals, and many of the almost all the hospitals throughout India have to adapt digitalization of the patient records to better apply AI tools and other digital apps. So coming to the global trends of digital health, so as per the data of by 2025, the number of mobile users worldwide is projected to reach about 7.49 billion, which accounts to 71, almost nearing to 71% of the world's population. So this is the data according to Statista 2025, and more than 7.4 billion smartphones are in use worldwide. And this is also according to Statista 2025. This accounts about 87% of mobile phones in the worldwide. Then coming to global mobile health app market, it is likely to value around 247 billion by 2025. And another report of Grand View and Research says that mHealth apps market is going to increase about 86.37 billion by 2030. Additionally, there is another Statista report says that there are about 65,300 mHealth apps available on the Google Play and iOS, that is Apple mobiles. There are about 54,000 mHealth apps available. So this is about the mHealth apps market. It is going to increase 86%. 86.37 billion by 2030. So we have seen the global market, and there is a survey of worldwide data which shows that most of the people, that is majority of the people, around 96.3, access data by a mobile phone. So this says that about the first statement, how the mobile phone, without the mobile nobody is, I don't think so. Is there anybody here without the mobile phones? Students? Is anyone without the mobile phone? Yes or no? No. So obviously it is all of you have access to the mobile phone with the data access. Am I right? So let's see the digital state of India. So the state of digitalization in India in 2025, what is the state? So mobile technology is permeating progressively into daily life. That means without mobile, no one is surviving. Okay, and a total of 1.12 billion cellular mobile connections are active at the early 2025, and with this figure equal to about 66.7% of the total population. So this data is according to the data reportal India. And Indian edition of Global TMT Publications, it's a report on technology, media and entertainment, telecom, predicts that India will have 1 billion smartphone users by 2026 and become the second largest smartphone manufacturer in the next 5 years. So India is going to become the second largest smartphone manufacturer. So more and more people, this data says that more and more people are spending a considerable time on the mobile phones, and they are accessing the mHealth solutions in India, which is making mHealth is a desired solution for accessing the healthcare facility. So let's see about the evolution of mobile devices in healthcare. So actually it started with laptops and then personal digital assistant, that is personal computers, and then netbooks became an inexpensive option. So when we have studied, see I have entered nursing, BSc nursing in the year 1994. So during that period we did not have this kind of this much technical advancement, and we have to buy the textbook which was costly around 4,000, 5,000, which used to be shipped from US. Okay, so now with the advent of this technology and mobile devices, it has become, netbooks and other options of technology, which has made everything cost effective and easy to access. And other applications, other digital devices are tablets, smartphones and mobile devices, which have emerged later. Now coming to, let's see what is e-health. I hope all of you are familiar with e-health. Have you heard of the term? Yes? Can anyone say what is e-health? It's an emerging field in the intersection of medical informatics, public health and business, referring to health services and information delivered and enhanced through the internet and related to technology. So all the information all easily accessible through the internet, relating to public health, relating to health and all the healthcare, everything is available through the internet. So that is called e-health, and mHealth is a subset of field of e-health. So now let's see what is mHealth. mHealth is the use of mobile and wireless technologies to support the achievement of health objectives. So this definition is according to W Health Organization. So World Health Organization, and say it is a very simple definition. That is, it says it is the use of mobile and other wireless technologies to support the achievement of health objectives. So in the healthcare delivery system, you are going to use the mobile and other wireless devices to integrate and access the healthcare delivery. mHealth, another definition given by Foundation of National Institute of Health, it says the delivery of healthcare services via mobile communication services. So it is the delivery of health services through mobile services. Coming to importance of mHealth. Why do we learn about mHealth today? because one of our concept of our conference is digitalization and other technological advancements. Okay, so why we are learning today about health? Because of unprecedented growth of mobile phone users. I have said almost 93% of the population access data through the mobile. Okay, and rapid expansion of mobile networks, and also there are a lot of innovations in the mobile technology. You have Android and other smartphone devices which are available in the market now, and task shifting and other healthcare systems. So we healthcare, as healthcare professionals, we should be prepared to shift towards our the change in the revolution of the digital, and we need to integrate the changes, and we need to be updated with the skills to operate all the AI powered on all the technological advancement into the healthcare delivery. So these are the goals. Already madam has covered this point, so I am not going to repeat it. So let's see, this also ma'am has briefly given an overview about what are the devices which are included in the digitalization of healthcare. So these are most common devices which are used: tablets, smartphones, apps, and wearables and implantables. Can you say wearables? Can you say some of the wearables? Smartwatches, very good. So what are the uses of smartwatches? Yes. Yes. Very good. Okay. So you all know the uses of tablets, so I'm not going to spend much time on this. Smartphones, you are more expert than me. And wearables, you already know which are the wearables. One said it is most common use is watch. Okay, so wearables can be integrated into various accessories such as garments, hats, wristbands, socks, shoes, eyeglass, and other devices. There are some sensors, mostly medical grade ones, are used on the standalone basis. So wearables, how they work? They track and trend activity levels. It is used more on fitness. Yes. Okay, and it senses and analyzes the information from the substances emitted from the transdermal source. See, watch you are tying on the hand, a wristband you are tying on the hand. So it senses from the transcutaneous or from the skin, and it transmits, it generates the data on our parameters like pulse rate, then respiratory rate, oxygen saturation. Okay. So use social media to enhance the user accountability. It also has a peer pressure effect. So these are some of the wearables. So coming to sensors. So how do the sensors work? So I said even wearables work with a sensor. So sensors, how do you work? So it works in 3 simple steps. It measures your physiological parameters such as blood pressure or even pulse rate, and it communicates with your phone, tablet or PC wirelessly, and it alerts based on the analysis of the collected data. So somebody said as an example of smartwatch, suppose when you use it, suppose your heart rate goes down or goes up than the normal, it will give an alarm sound. Even oxygen saturation, if it is giving, if it is abnormal, it is going to give an alarm sound. Okay. Then implantables have been around and now it has been redefined. So the possible vision and correct enhancement, it gives data on vital signs and blood glucose monitoring, and it relays information back to nurse and case managers or physicians. So the various implantables which can be used on the body of the patient, that relays information to the healthcare providers so that healthcare providers can take prompt action and intervention. And it helps in diagnostic also. Excuse me. So there is a smart ECG monitor. It has 3 lead wireless ECG, and it continuously sends ECG readings to the user smartphone or via Bluetooth. And from there, it sends the data over the mobile network to the server. So patient's doctor or consultant can access the readings via a web browser. So there is a device, stethoscope. It is the company Littmann electronic stethoscope model 3200. Your physician focuses on listening to your heart rate while the stethoscope sends your information wirelessly to a PC or laptop or mobile device. So this when the physician auscultate with this type of stethoscope, it can transform the data to the PC or any other device. Then pulse oximeters. So this, we have used, most of us individually we have used during the COVID-19 period. Individually we have bought this oxygen to monitor the oxygen saturation. It is handy and it can be used very easily on your finger to sense and then give you the data about oxygen saturation. So heart rate monitors, this is also most common devices which is combined with the Bluetooth smart devices to analyze or to assess the heart rate. And next one, body monitors like watches. It gives you data on about your sleeping patterns, about the heart rate, about the oxygen saturation, about breathing pattern. So GPS receiver, I hope you all know better than me. What do you mean by GPS? Yes, global positioning system. What is the function of it? Yes, to find it gives you information about the location. It gives you the information about the location. So this is the most common use. So it works, how it works? Okay, it relies on the radio waves and it communicates with the satellites that orbit the earth. So there is a communication between the satellites which orbits and give you the information about your location. So the location, so how the satellite communicates? The locations of at least 3 satellites above you and where you are in relation to these satellites. So it is going to give you three satellites are going to work out the location where you are and it is going to give you the information, and the receiver then uses trilateralization to determine your exact location. So how this GPS, everyone's Android, it is there, GPS is available. So how this GPS phone works? It has a GPS chip inside. Chip uses satellite data to calculate your exact position, and as long as the sky is clear, the geolocation on your app can ascertain your position accurately, and it gives the information to the receiver about the location you are. So remote surgery. What do you mean by remote surgery? This is also a technological revolution. We have heard of telemedicine, telehealth, right? So there is remote consultation is possible. So likewise, remote surgery also is possible with the digitalization and mHealth. So in this, the ability for a doctor to perform surgery on a patient even though they are not physically on the same location. So for this, they need to have a robot to perform. Okay. So from remote, the physician will not be even at the location of the patient, but through the robotic engineering, this is applied, and this even remote surgery is possible with the digitalization era. So now we have seen some of the devices. Now I would like to have 2 questions to the audience. Because you are all more expert than us in using mobile phones and apps. So I have a question. What are the healthcare apps? Have you ever used healthcare apps from your mobile? How many of you have used? Raise your hands. No, have you used? I am asking, is anyone, you have used? Not delivery app, any other app. Has anybody used any medical or healthcare apps? Nobody. Okay, so I have two questions. Just you have to, from to those who are sitting on my right and those who are sitting on my left, you have to note down this question and you are going to answer me. One representative has to come here and just give your view. Okay. So what are the medical health apps available in the Google store? Wait. So this is the first question to the on my right and left side. What are the government initiatives, Government of India initiatives on M-Health? That is, what are the mobile health applications which were initiated by the Government of India? Those who are sitting on my left, you have to answer this question sitting on my right. So you are ready? Please come. Please give the hand my. Please take the hand.
Good afternoon, everyone. Myself Shivam Shukla from College of Nursing, Kanpur. As ma'am has asked about the Health apps which are available on Play Store. The first app which is initiated by the Google itself only, that is Google Health. And the another question ma'am asked is the which app has been started by the government of India?
No, that question to that side I want.
Okay. Next question. The second one.
Yeah.
Second one I have to ask. Ma'am asked the which app has been started by the government of India. That is Arogya Setu app in the COVID time that has government launched. And recently for the BMS students, app was launched by the government of India. I didn't remember its name. I'm forgetting, but Arogya Setu app is the only app that has government started during the COVID times. Thank you, ma'am.
Actually, Arogya Setu is one of the first ever app which was initiated by the government of India during COVID-19 period. Okay, and it was accessed by millions of people during COVID period. It's good, but there are other initiatives by government of India also. I want one representative to come from the other side of audience to answer me. Please, anyone come forward from left side of me. What are the other government of India initiatives? Please remove this. I will use this one only. Yes, please. Anyone? Any audience? So that means you are not familiar with the government of initiative towards M-Health applications. Okay, so let me proceed. Okay, these are different types of mobile health apps for patient. So there are different types of apps here: clinical diagnostic apps, remote monitoring apps, productivity apps, reminder app, text and video communication app, prescription apps, mental health apps, fitness and wellness, chronic disease management, and health education. So let's see one by one fast. So what do you mean by clinical and diagnosis apps? By name itself, it helps a physician to diagnose. Okay, so these type of apps help the doctors and physician to collect the data and analyze, and they are able to make a diagnosis of the patient and it also helps in the clinical decision making of the physician. So remote patient monitoring, this ma'am also has covered some of the points related to remote patient monitoring. This we have seen in the telehealth medicine or telenursing also. So from the remote, how to monitor the patient and how to assess the patient and how to extend intervention and provide healthcare services to the patient. So here it's a technology to enable monitoring of patients outside the conventional setting. Okay, and it depends on the disease and the parameters of different combinations of sensor, storage and applications may be used. So here physiological data collected by sensors or peripheral devices, and here in some chronic disease it is able to improve the individual's quality of life. So when a patient is suffering with a chronic conditions like hypertension or diabetes, there is regular monitoring, frequent healthcare checkups. The patient may be unable to go visit the doctor. So in that case, so remote monitoring can be done, and it gives the data to the physician, and the physician can give interventions or decision accordingly. So productivity app, there are number of mobile apps for health that help increase the productivity and efficiency of the healthcare providers. So how it gives, so these productivity apps, they integrate the information of the patient data and records and investigations, and then it provides information to the physician or healthcare providers, and how it helps in effectively taking decision and taking care of the patient. And reminder apps, this most thing we have seen during COVID periods. Now there are so many reminder apps are available. So during COVID-19, we used to get messages regarding vaccine track, and also if we are about to receive and we are missing the schedule, it will send constant reminders that you are supposed to take this, you are due for taking vaccine, like that we used to get. So this was the large reminder app which was used during COVID-19 period, and now this reminder apps even for available for tuberculosis and other chronic conditions also. And text and video communication apps, this is the best example during COVID pandemic. So a lot of us, we were receiving lots of video messages, text messages, and now also some of the mHealth applications which are applied by using this function. Then prescription apps. In India, we have lots of prescription apps which gives you about prescription, and also gives you details about the medication dosage, and also even some of the apps deliver the medication at door of the patient. Then mental health apps. So there is a most popular app called Calm. It helps you in relaxation and also reduction of stress. The fitness, there are number of apps, and which is most famous popular app in India is Cult Fit. So it is about promoting physical activity, healthy eating, and all. It is about lifestyle. So it is fitness and healthy eating, and also about overall wellness. It includes apps for running, yoga, meditation, and personalized fitness coaching. So this is the Cult Fit app. It gives this platform provides a free 7-day trial to gain a feel for the teaching style and training type. So it gives a free trial for 7 days. Then chronic disease management apps. So I said some of the chronic diseases which needs regular monitoring and regular visitations to the physician. So this app will help you to reduce the number of visits to the physician, and it will help you to maintain healthy parameters or under control. For example, diabetes, to maintain blood glucose and to maintain blood pressure in normal levels or under control. So these are some of the apps, top apps, which are used in the chronic disease management, which are available in India. So MediSafe, Sleep Cycle, Bearable, Curable, EpsiHub, Lucid, Super Better, Asthma, MyCOPD. So these are some of the apps for chronic disease management. Then there are some of the apps for health education and awareness. These are the top medical education apps that are used in India and global also. And these are the top apps which are used in India. So, first one is National Health Portal. So, under National Digital Health Mission, India has launched in the year 2021 during the COVID period, and it has this app allows the patient to, there is a login ID required, and they can access to the data, and it allows telehealth consultation also through the Digital Health Mission India. Then 1mg, it is the most popular app which is used in India, and these are the other apps we have already seen. And the Flow app is about menstruation and for women. It provides information about the menstrual cycle, and also it helps you for getting all the information about other irregularities and disturbances. And it's a password protected app which women can use safely. So this is the data of the survey throughout the world. How much percentage of the population are using different kind of apps for different purposes. So about 32% of are using for remote monitoring, 31% are used for diagnostic apps, and 30% for medical condition management, and 29% of them use for remote consultation, and 28% of for maintaining patient health record, and fitness tracking 27%, and for nutrition and weight loss, that is lifestyle 26%, and reminders about 18%, and medical compliance, that is in light, for example, in tuberculosis, two reminders for medication, that is about 16%. So now let's see about the research evidence of, we have seen so many apps and so many mHealth applications. So what has been the research done on this area? So there is a study which is published, doctor consultation through the mobile applications in India, an overview, challenges and the way forward. And the study was conducted by Neeraj Agrawal and Bijit Bitwat, Department of Community Health and Family Medicine, AIMS Patna. Objective is to lay out mHealth mobile applications operating in India. So it's a cross-sectional study, web-based study was conducted, and searched the Google Play Store with the search strategy, health apps in India. In the results, 250 applications appeared, and out of 250, finally 22 apps were found to be providing online doctor consultation and doctor appointment booking related services. So these were the most common apps which were used in India, like Practo, Mfine, Liberate offer doctor consultation, and NetMeds and Doctor app offer doctor consultation through both chat and audio call. 1mg offers free chat consultation, while MediBuddy and MedLife offer audio call consultation only. So these are the most common apps which are used in India. And this study concludes that mHealth apps providing doctor consultation are gaining popularity in India, and they have enormous potential in the country, and the government should take enabling policies to facilitate and popularize mHealth apps. So based on the study's finding, these are the top 10 medicine delivery app in India. So we have already seen in the research finding also. So there is another evidence on awareness and usage of mHealth apps. How many of them are using mHealth apps, accessing? How many of the population accessing the mHealth app or using the mHealth apps? So the results of the survey revealed that 56.3% are aware of the mHealth apps. However, only 31.6% of them are using mHealth apps. And 40.9% are not using mHealth apps because of lack of awareness. So almost about 41% are not aware of the mHealth apps. Of the people using mHealth apps, 49% and 30% use app for fitness and lifestyle purposes, and 6.1% are using for mental health, and 13.8% are using for women health, and 92.7% download for useful for them. And however, only 32.2% will download if it is paid. So if there is you have to pay and access, they only 32% are accessing. And 22.2% of people use apps to track their activity, means for the purpose of fitness. So these are some more data about the study. So coming to mobile health application, what are the benefits of mobile health application? So madam has covered this point already. So it reduces the risk of misdiagnosis because all the data about the patient through digitalization, it is available. So when it is available, when you do the manually accessing the data, there are chances for committing errors and mistakes in diagnosis. So this can lead to mismanagement and misdiagnosis of the patient. So by using digitalization and electronic health records, so this can be prevented, and also patient there are less chances of committing errors and misdiagnosis of the patient, and it is easier for access to the medical reports. So the patients need not, sometimes manually carrying reports, they might be they might forget to carry some reports while during the visitation of the hospital. So this is mHealth provides all the reports are available online. So there is no need, no issue of forgetting or carrying. So it is easy access for the patient as well as the healthcare provider. And next one is optimized person hours. So long working hours, especially for the healthcare providers, for doctors, nurses, long working hours is the major burning issue throughout the world. So because of which leads to stress and anxiety, stress and other problems to the healthcare providers. So by use of mHealth applications, it can reduce the time, and it makes the delivery of care more effectively and efficiently with less time consuming. So it optimizes and work effectively, and timely care at remote locations like telehealth application is integrated, and real-time communication. So here with mHealth application, there is a seamless communication between the technological advancement, and that relays information to the healthcare providers. All the digital patient records are available through digitally. So there is a seamless communication between the healthcare provider and the patient. So even the remote patients also can benefit through remote monitoring. And it is most convenient for bill payment. So bill payment manually is the tedious process, both for the persons in the hospital, in the billing section, and also for the patient. Long waiting hours, long manual process, all these are reduced, and the time spent on this is cut down, and it is there are so many options available on the online for the patients to choose, and it reduces the time spent on the billing process. So these are the most of the benefits, and these are some of the most top types of mHealth applications or softwares available. So electronic health records, ma'am has enlightened us in detail about this. So are you all familiar with this? Yes or no? I am not getting any response from the audience. Are you all sleeping? Okay, so electronic health records, then clinical data management platforms, telemedicine, it is remote consultation, then sensors, how it works, you all know. Then robot surgery, I told, this is integrated with remote surgery. And then IOMT, that is Internet of the medical technology. Okay, it is integrating the medical digital devices and information and exchange of data. Okay, and patient scheduling software. So here this is about the appointment and visits to the doctor. Software for healthcare. Then coming to what are the essential features. So when mHealth is applied, what are the essential features you have to focus for the patient and all for the user or provider also. So let's see first about the extensive features for the user panel. So it should be easy. Any app which is developed, if it would become successful only when you are going to access easily. So easy sign up process should be there. It can be signed like the app. There should be provision for the user to access through the mail, a login ID or a mobile number or any other easy way. And user friendly interface. This also ma'am has explained. So whatever apps you are using, it should be user friendly. If they are ignorant to use that, it is not going to be successful. So personalization, so any app you invent or you develop, when you design, you have to take into consideration to cater to the individual needs and also preferences. So customization should be provisional. And then remote consultation, so any app, it should allow for remote consultation for fixing the doctor appointment. The next is app should also provide access to library and all the health information available. Then coming to essential features of other essential features should be there. So it should integrate with the tools available for tracking healthcare progress, and also information should be available in multiple languages, not only in one languages. It should cover many language options should be there, and offline. So main thing is everybody cannot access to data. So the mHealth solution which you are going to develop, you see that it works without the internet connectivity and data use for easy access. And appointment and scheduling reminders. So this app should have features for scheduling appointments and also for reminders for medications or reminders for schedules. And medication management and notification. So this is about, there are so many medication apps I have told you. Most of the medications which are, medication apps which are used in India deliver the medication at their doorstep, and also there are other features like reminders also. Next is community and support networks. It connect with the support groups. So there should be a provision for when you develop the app, it should have the provision to connect with the healthcare professionals and other support groups. So these are features for healthcare providers. So what are the features? We are not talking, so far we have discussed about the features for the users. So now we are going to see about features for provider panel. So for there should be data security and privacy, because lots of data, all the patients' records are digitalized. Information is available. So there should be control and protection for it. And then interoperability. So there should not be any disruption or interruption in operating the system. That means, see, for example, if there is no electronic health record is available, you cannot get it cannot relay the information about the patient to the healthcare providers, and then they cannot. So there is one app is there, but there is a interoperability issue because digital record is not available. So there should not be any interoperability issue, which should allow seamless integration with the electronic health records and other medical devices to function properly. And clinical decision support, it helps the healthcare providers to make clinical decisions based on the relaying of information about the patient, about the investigations, about other things. It relates to the healthcare professionals, and then it helps in decision making support, and it's real time monitoring. So it allows the physician or healthcare provider to track about the vital signs and other parameters and provide alerts during critical time, so that remote monitoring can be done. So coming to uses of mHealth solutions in the health, and we are going to see the most areas of the mHealth solutions which have been applied in India and globally in these areas. So in family health, maternal and child health, HIV and AIDS, vector-borne diseases, tuberculosis, and health system functions. So we'll see some of the projects which have been implemented globally and also in India. These are some of the famous and popular mHealth solutions and projects which were undertaken both internationally and nationally. So this is mobile for reproductive health, M4RH it is known as, and it provides information about family planning methods and also clinical locator service with text messages. Okay, and this is an award-winning automated interactive on-demand short message services. SMS and text message was sent to the users or beneficiaries about the information on reproductive health. It was globally implemented. Okay, and it was developed in 2009 and piloted in Kenya and Tanzania. And it was one of the first services to take advantage of increasing ubiquity of cell phones to put accurate reproductive health information. It then expanded its content and reach and has been adopted by various organizations around the world. So initially it was introduced in Kenya, then later it was used in many countries around the world. So next, coming to mHealth solution in family planning. So this is CycleTel. It's a unique mobile health service that offers family planning method directly to a user's mobile phone via short message service. And actually it was piloted in India. It was introduced and found by Georgetown University's Institute Reproductive Health based on Standard Days method on family planning. So it's a fertility awareness based method that helps a woman to know which are the days during menstrual cycle she is most likely to become pregnant. So these are called as unsafe days. So there is a text message delivered to the all beneficiaries. By this they get awareness about which are the unsafe days, and so that they can plan for family planning. So somebody said when I asked about which is the most popular app initiated by Government of India. So this was the one pregnancy and birth app. So Ministry of Health and Family Welfare has launched a free and offline safe, it can be used during offline also, a safe delivery app in 2018 to support the midwives. It has a user guide for midwives, nurses and all the healthcare professionals in providing high quality obstetric and neonatal care. It can be downloaded free, and it gives information on how to stay healthy during pregnancy, how to recognize danger signs. So the information provided to the healthcare guides to the healthcare providers, and what to do during when a danger sign arises, when to refer a woman to emergency care, and instruction for community health workers. Step-by-step explanation is there, how to take blood pressure and how to stop bleeding and what to do when there is a danger sign arises. So coming to strengthening health system. So in this area, this is the most popular project which was implemented in Karnataka using M-Health applications. So this is called Drishti Smart Registries platform. So it uses Android tablets and multiple applications to improve reproductive, maternal, newborn and child health among rural populations in Karnataka state, India. So it allows registration. So this is the Drishti Smart Registry functions. It starts care from the prenatal period and during pregnancy and during birth, and also postpartum period, and in newborn it covers newborn and the infancy and childhood also, and maternal health is covered prenatal, intranatal and then postnatally, and risk assessment is done in all these period. There is another famous project which was implemented in India, Remind. It is called as Remind. It is called as reducing maternal and neonatal, maternal and infant mortality rates. So here it's a view on, it is an ML solution reducing maternal and newborn deaths. That's why it is REMIND, it is called in short. This project was applied in UP, India. It equips the government community health workers, ASHAs, because it gives a job aid, what a ASHA is supposed to do. It clarifies her, it helps as a job tool for her with multimedia phone-based job aids to support client assessment, counseling, treatment and referral, and implementing partners are Catholic Relief Services to illustrate ML solution development of best practices. So this was implemented to reduce the maternal and newborn deaths. So next popular M-Health solution which has been implemented in India and currently going on with huge users, that is called Kilkari. The Kilkari is a mobile-based service launched on January 15, 2016 as a part of Digital India initiative for new and expectant mothers. It delivers messages about pregnancy, childbirth and childcare directly to the beneficiaries. Now it is the largest mobile-based maternal messaging program. It has reached about 53 million women and their children across 27 states in India and union territories of India, and currently it has about 4.3 million active users. And Kilkari is a mobile health educational service that provides pregnant women, newborn, new mothers and other families with timely, accessible, accurate and relevant information about reproductive, maternal and neonatal child health. And this program was implemented in partnership with Ministry of Health. It was implemented with the Government of India, initiation of Government of India, and currently we have large, huge users. So currently, it uses interactive voice technology to deliver time-sensitive and information directly to the families and mobile phones. So where it also covers the critical period time where the most maternal and child health deaths occur. And subscribers receive one pre-recorded call per week and catering to the women's state of pregnancy, and it is available in almost 8 languages. So the languages available are Hindi, Bhojpuri, Oriya, Assamese, Bengali, Telugu and Marathi and Gujarati. And Kilkari project currently serving in 20 states and union territories, 27 states and union territories. Now the recent revision is done for this solution in this project. So current version is Kilkari 2.0. It aims to use multiple delivery channels. So initially it was started as a text message. Now currently there are so many proposals for using interactive voice message technology and for using WhatsApp, YouTube and a dedicated mobile application for targeted messages. And the pilot test of the feasibility and effectiveness of WhatsApp as a delivery channel is currently going on in 2 states. So now the pilot study is going on in 2 states. On 7 February 2024, Kilkari project has been launched in 2 states, namely Maharashtra and Gujarat. Here, WhatsApp effectiveness is pilot is ongoing. So the innovation will be scaled up to 2 to 3 states during 24 and 25 and pan-India from 25-26. So these are other Government of India initiatives in mHealth. I asked you a question, what are the Government of India initiatives have taken? So I have discussed some of the projects which were implemented in India. Now currently, which are the initiatives which are going on? You know very well about Arogya Setu. It was very famous popular during COVID period. That was the first ever app developed. Then now currently recently introduced is vaccine tracker app. So this vaccine tracker app, you know that even though so many immunization programs are available, services are available, many of the children, about 40% of the children are not immunized. They are dropped out or they don't receive some of the immunization. So this app has been recently developed to track the dropouts or to track the children who are not immunized and then direct them and give reminders for receiving the immunization. Okay, so other apps like India Fights Dengue app, Swasth Bharat mobile app, National Health Portal, already I have told about. Then RACOS to improve healthcare services. Then about electronic health records. You know that Ayushman Bharat, yes. So under Ayushman Bharat, this National Digital Health Mission, it provides provision for maintaining digital record of the public and also allows for telehealth consultations. Okay. So that delivery of services to the citizens can be delivered through online mode through the electronic ecosystem. So far we have seen what are the most popular projects based on mHealth which was applied and implemented in India, different states of India, and some of the studies we have seen. So now we will see some of the research evidence of mHealth solutions. These are the studies which I have taken from a systematic review which they have analyzed about what type of mHealth intervention they have used and what result they have found. Okay, so this is a Brinja et al. Study, survey among women and or mothers of 1-year-old children. The intervention was pregnant women and mothers using an mHealth app. Control, there was control group was women and mothers not using mHealth. So there is a intervention group and control group, and the result is improvement of iron and folic acid supplementation, identification and self-reporting illnesses during pregnancy. And so they found that the mothers who were given with the intervention of mHealth, there was found with the positive results in iron and folic acid supplementation. And Modi et al. A study was conducted by Modi et al. India, the population, rural tribal communities of Gujarat. And here intervention was, it is a mHealth package and 11 PHCs were covered and 280 ASHA's population, and control group was without an mHealth. So there was an mHealth package for covering the maternal packages. So the mobile apps which was IM-TECO, the intervention application was used is IM-TECO mobile applications were used by the ASHA and PHC, and it significantly improved the coverage of home visits by ASHA during the antenatal period. There is another study. So the study has 3 groups. It is who received standard care government program, and there is an intervention group who received mHealth package through a NGO, and there was a quasi-control group. And the findings of the study showed that women in intervention group reported higher levels of maternal health knowledge than those who are in the NGO group and then those who received standard group. So this study also proved there is an improvement of using mHealth applications in coverage of services. There is another study which was done in UP, India. Pregnant women and mothers using mHealth app in control group, women and mothers not using mHealth application. So this already I have discussed about Remain project, which was applied in UP for reducing neonatal deaths and the maternal mortality rate. So this study on a Remain project, this study was conducted, and it was found that mHealth intervention as part of this program was cost effective, and also it was reaching to the rural and outreach areas also, and coverage of services it has improved. So it reduces the cost of disability. So this is another study which was done in tribal communities of Gujarat, which showed IM-TECO program which was effective. So mHealth application which was applied through the IM-TECO, it was effective, but the study recommended that it need to be replicated. So these are, so far we have discussed about the popular applications and the projects which have been done and implemented globally in India, and also what are the government initiatives on the mobile health. Now let's move on to the challenges. You know, when you use any technological advancement, there are challenges embedded with that, because you know that technology is a double-edged weapon. You know, how much advantages it has and how that much demerits also it has. Okay. So we need to address the challenges for effectively and safely implementing. So first challenge is data security and privacy concerns. So when you are using, because lot of information patient record is available electronically, so we need to take care about the security of the information digitally. So for that, we do not, as of now, India do not have any equivalent system like HIPAA, Health Insurance Portability and Accountability Act, which was developed in US, and it is an international law which is providing guidelines about the privacy protection of the patient information. But we do not have an act in India equivalent to this HIPAA, but India has developed a law on 2023, that is Digital Privacy Protection, Digital Privacy and Data Protection Act. Okay, so that gives you guidelines how to protect the data of the patient. So solution is we have to use end-to-end encryption and use safe authentication, and we need to follow either international guidelines or we need to follow what is the Indian guidelines to protect the information and privacy of the patient. Challenge 2 is interoperability. So interoperability issues will happen if you are unable to integrate the electronic health records and about the patient information with data exchange information with technological devices. So when patient data is not available, even teleconsultation and other remote functioning, the doctor or physician cannot take any action. So there is a disruption of the communication between the healthcare provider and the technological devices. So they see that there should not be any disruption or interruption in the delivery of healthcare. So you should take care of this interoperability issues. That means electronic health record should be digitalized first. Okay. Then solution, already we have discussed, fast healthcare interoperability resources should be facilitated. And for that, electronic health records should be systematic and digitalized. Information should be available. Then challenge 3, user engagement and adherence. So encouraging consistent usage of mHealth app and promoting adherence to treatment plans can be difficult. So how it can be rectified? That means employ personalized notification. That's what so many things we have seen through text messages, through WhatsApp, some of the videos. So these are some of the solutions like personalized notifications, sending reminder messages. These things can overcome the challenge. Then coming to technical complexity. So developing mHealth app involves dealing with complex technical requirements such as real-time data syncing, offline functionality, and cross-platform compatibility, which can increase development time and cost. So technology, any technology is cost, but if you want to use, then you have to increase the accessibility and reduce the cost. So that should be taken care for reducing. So for that you have to develop some of the factors. So this is agile development, means it is breaking down the project into small cycles, and which can be, each cycle can be shipped separately. So that when the software is done and developed, this can be integrated. Next challenge is regulatory compliance. So we have discussed about HIPAA, and I told you about the data protection in India also. It is Data Digital Privacy Protection Act India 23 that helps you to overcome this solution. Then coming to integration of emerging technologies, there are so many. Yesterday onwards we are discussing a lot about AI, how it can be, what are the AI powered tools in education, in the healthcare delivery, in the research. So we have seen so many things, and these are the technologies like AI, IoT, Internet of the Things, and wearable devices are. So there should be integration of seamless integration of all these technological devices. For that, you appropriate software should be used for integrating these with for seamless use. Okay, for that, application programming interface and software kits should be used when it is designed, so that when you are designing app, even you need to have a professional to implement this area. Then coming to scalability and performance, ensuring mHealth app can handle a growing user base and increasing data volume for optimum performance. So coming to these things, this is a software which has to be applied by a designer. That means the company who is developing the app or application, to them, they need to integrate with the softwares to overcome this challenge. So these are some of the things, and most of the things we have already seen. What are the current trends? Telemedicine in health apps. Telemedicine is integrated with health apps, and AI machine learning is integrated with the health apps, and wearable devices in integrated, blockchain for security and protection of information. Okay, and then mental health apps and chronic disease management. Then recent technology, I told you about Kilkari voice recognition technique, and even in AI, it is the most common application which is used in AI powered tools, that is voice recognition technology, and augmented reality for training. So for training the healthcare providers and students, that is simulators, augmented reality simulators, it is used, and gamification in health. So it is making more user friendly for the users, and to increase the access of the facilities, and internet of the medical technology. So here integrating all the digital devices and exchange of data and relaying the information to the healthcare providers. That is called internet of the medical technology. So these are the current trends. So these are the steps when you want to implement a mHealth solution. So if you want to implement a mHealth solution, what you have to do? So these are the steps. First thing, you should identify a problem. So what you want to address? What is the most common issue for which you want to develop an intervention and you want to address the issue that you should identify. Then next one, choose the platforms. So you should, after identifying the problem for which you want to design a software, then you have to think about which platform you want to deploy it. Usually we are deploying in the mobile, whether Android or in the web. So you have to consider all the age group, right from children, right from all the age group people, and elderly also you have to take into consideration to make it user friendly. So elderly people may not be comfortable in accessing mobile, so there you might consider website also. So you have to decide about which platform. Then hire an app development company. So after choosing the problem and after choosing the platform on which you want to deploy, then you have to hire the professional company who is going to develop, and you want to, what feature, what a core feature you would like to want in your solution, that you have to communicate with the company. Then next one is select a monetization model. So then think how you are going to introduce the model. So whether you are going to use a subscription subscriber base, or you are going to go for a paid one. So if you are going to paid one, then you have to for access you have to pay and then use. So you have to decide whether you have to go for a subscription basis or you want to go for a paid option. And next one, build a MVP. So MVP means minimum viability of the product. So when you are initially, when you are launching an ML solution for any problem, you should take into consideration that in the initially itself you are not going to integrate so many things full-fledged way. You are not going to launch it. So you are going to launch it with only the basic feature. What is the basic core feature you want to implement in your solution and deploy. So for that you are going to make only core feature, and then you are going to test it, validate it, and after finding the validation results, how is the user able to access and user panel, everything fulfills or not. After validating its effectiveness, then only you are going to scale it for a large population. So that is called build an MVP. Then after building and making a core feature, then you have to test your app. After testing, so when you are testing whether the users, beneficiaries who are accessing your app, are they able to access it, even like data, without data you are going to access, or the languages, multi-languages, is it available, and it is easy for signing up, and is it understandable, so many features, without data and internet, is it possible to access. All these things you have to consider and then validate. So after this result, then you are going to develop as a you are going to launch it and then scalable to a larger population. So all these things I have explained you. So this is what is the step. So when you come out with a concept and solution, first you come out with a concept, then design a solution. After that, evaluate and validate. Then you go for scaling up to a larger population and then implement. So when you are implementing a ML project or a solution, who are the partners? I said lot of initiatives have been taken by the state government and also have been taken by Government of India under National Health Mission. So we need partnership to initiate and implement. So you need to have a broad base of key partnerships, that is Ministry of Health and Family Welfare, and NGOs, it is non-governmental organizations, and a technology partner, because we are not well versed and we do not have expertise in developing software. So we need to hire a company with whom we are going to collaborate with our core feature. And next, telecommunication companies are the partners. So these are the partners you have to consider when you are designing a mHealth. Then these are the limiting factors. So we have seen, if it is lack of electricity, we cannot use, lack of some of the apps cannot be used without data, and the cost of phone is very high. So these are some of the limiting factors. So we have come to the end of my session, mHealth. So mHealth is, what do you mean by mHealth? Audience? Yes? Mobile health means what? Yes? So you are using the devices and technology to relay the information of the patient, and there is a collaboration and communication between the healthcare providers based on the information and the technology use and cater the healthcare delivery. So as we all know, any technology is a as much as it is a boon and it is a ban also, because it's a double-edged weapon, or you can say double-edged sword. So you have as number of advantages, that many demerits also is available. So we have seen yesterday a lot of things about technological tools, AI, and today we have seen mHealth, digitalization, and internet of the medical technology. Some of these technologies we have seen, but technology is not a replacement to the human touch, right? Human touch can never be replaced by the machine. But only thing we need as human beings, we need to integrate all the technological devices for efficient delivering of healthcare services, and also integrate it into nursing education, so that all the students and nurses are prepared with current in par with the current technological devices, and also to provide the healthcare services effectively and efficiently. So it is not a replacement. AI is not a replacement for human tool. AI will not replace, but human with AI will replace human without AI. Do you agree? Humans with AI will replace humans without AI. So it is mandatory for us to be well equipped with all the technological devices, and to prepare in nursing education also, and also in the delivery of healthcare services. This integration of all these technological devices is very much important. So with this note, I would like to conclude my session. Thank you, ma'am. Thank you, Deepti ma'am, for giving me an opportunity.
Thank you so much, Dr. M. Radhika ma'am, for your valuable insights. I would like to invite Ms. Percilia Fernandez ma'am to kindly provide your valuable feedback, ma'am.
So thank you. Ma'am Radhika has comprehensively covered the topic of mHealth, and I'm sure that she must have gone through the detail to present the presentation. So thank you so much, ma'am. And I think so mHealth, comprehensively what we have seen today's lecture, it is, first thing is, I think so we all accept that it is very, very important after the madam session, right? Yes, and today we discover that mHealth has started from eHealth. Madam has described from how much mobile used is there, from 4% to 96%, the goals behind it, and the very comprehensively she has touched upon all the apps which is used by Google's and the government projects like Kilkari and maternity health. These are so much important topics she has touched upon. I think so ma'am has covered almost all the requirement which was there from mHealth, and specifically on the chronic disease condition, how patient is going to benefit from mHealth, and also the upcoming projects of the governments, and there was a detailing on the projects and the requirements, and how we can accept that in the healthcare situation. It was very well incorporated in the presentation. So thank you, ma'am. Thank you so much. Thank you.
Thank you so much, ma'am. As a gesture of gratitude, I would like to invite Ms. Pooja Pandey ma'am to kindly present forward and present a memento to our speaker, Dr. M. Radhika ma'am.
Thank you so much, ma'am.